In this video, we'll be talking about trisomy 18, also known as Edwards syndrome. So before we get started, let's break the name down. Tri means 3 and zomy means chromosome. So putting that together, we have 3 copies of a chromosome, specifically chromosome 18 in this case. So what exactly is trisomy 18 or Edwards syndrome? Edwards syndrome is a chromosomal condition that's associated with abnormalities in many parts of the body. Individuals with trisomy 18 often have slow growth before birth and a low birth weight. The affected individuals may also have heart defects and abnormalities of other organs that develop before birth, and we'll be talking about all these later on in the video. Due to the presence of several of these life-threatening medical problems, unfortunately many individuals with trisomy 18 die before birth or within their first month, and only about 5 to 10% of children with this condition live past their first year, and these children often have severe intellectual disability. So what are some of the causes of trisomy 18? The most popular proposed cause is due to something known as meiotic non-disjunction. So what exactly is meiosis in referral to the meiotic non-disjunction? Meiosis is a process whereby our sex cells divide and replicate while in the embryo stage. And when this is occurring, so as the baby cells are developing and replicating, each parent cell or original cell before it gets divided or replicated will pass along their full genetic material to their daughter cells, which are the 2 replicated cells they divide into, as you can see in the picture above. And each parent cell is supposed to pass along an exact amount, an equal amount of DNA or genes or chromosome to each daughter cell. But unfortunately, during non-disjunction, what happens is one daughter cell ends up getting both copies of the chromosome, whereas the other daughter cell gets none. And the daughter cell that ends up getting both copies of the chromosome will end up being the cell that has the trisomy. And in this case, that would be the chromosome 18 with 3 copies, which eventually leads to the trisomy 18. There's also another proposed mechanism whereby individuals end up also getting trisomy 18, but this is only seen in approximately 5% of people with Edwards syndrome. They end up having an extra copy of chromosome 18 in only some of the body cells, and this is known as mosaic trisomy 18. You can think of this kind of like in an art or a painting, where a mosaic painting is different parts of the art are all different pieces, but then they come together to create that art. In medicine, genetic mosaicism is the presence of DNA alteration in only some of the body cells. So each cell is different and they all come together to create the entire human being. But each cell is different, and that's why we call it genetic mosaicism. The severity of mosaic trisomy 18 depends on the type and number of cells that have the extra chromosome. So for example, if the mosaicism occurs in the heart cells, then they'll end up having heart problem. And if it occurs in the brain cells, for example, then they'll end up having neurological problems such as like intellectual disability. And the development of individuals with this form of trisomy 18 may range from normal if very few cells are affected to severely affected if a lot of cells are affected. Well, let's talk a little bit about chromosomes. So what exactly is a chromosome? A chromosome is a thread-like structure of nucleic acid and also proteins that are found in the nucleus of most living cells, and they carry genetic information in the form of genes. And usually we have 2 copies, one from the mother and one from the father. And these genes in the form of our DNA wrap up continuously, and they all congeal and conceal to form chromosomes so that they can fit into the nucleus. So a chromosome is practically a combo or accumulation of all our genes, one gotten from the dad, like I mentioned, and one gotten from the mom, all stored within the nucleus of each cell. In terms of the prevalence of trisomy 18, It occurs in about 1 in every 5,000 live-born infants, and it is more common in pregnancy, but many affected fetuses do not survive to term. And although women of all ages can have a child with trisomy 18, the chance of having a child with this condition increases as the woman gets older. But I want to use this point to emphasize that it is never, ever, ever the mother's fault. Junction. It occurs randomly during cell division and cell replication. So it's never the mother's fault, never the father's fault. It's something that occurs entirely by chance and entirely by random. Symptoms of trisomy 18 include small for gestational age, clenched fist, intellectual disability, cardiac or heart abnormalities, broad nose, cleft-lipped or palate, which is a break in the palate, which is the upper part of the mouth, microcephaly or small head, low set ears, malformation of the kidneys, as well as so many other symptoms that are not included in this list. In regards to diagnosis, the best way to diagnose trisomy 18 is during the second trimester, where a blood test is taken and a specific screening test known as a quad screen is ordered and looked at, and four different lab values are looked at to assess for the presence of trisomy 18 or Edwards syndrome. And then for treatment, unfortunately, there's no treatment for Edwards syndrome. The main focus should be on the mother's psychological health and well-being, as well as her physical well-being. And this also applies to the father, the rest of the family, and the loved ones. So, in summary, trisomy 18, also called Edwards syndrome, is a chromosomal condition that's associated with abnormalities in many parts of the body. This is typically caused by the presence of 3 copies of chromosome 18, and the individuals typically have various life-threatening conditions, ranging from cardiac abnormalities to intellectual disabilities to malformation of the kidneys. Due to the presence of several life-threatening medical problems, many individuals with trisomy 18 unfortunately die before birth or within their first month, and only about 5 to 10% of children with this condition live past their first year. Most cases of trisomy 18 result from 3 copies of chromosome 18 in each cell in the body instead of the usual 2 copies, and this occurs through a process known as meiotic non-disjunction. Approximately 5% of people with trisomy 18 have an extra copy of chromosome 18 in only some of the body cells. In these people, the condition is called mosaic trisomy 18, and the development of individuals with this form of trisomy 18 may range from normal to severely affected. It is also important to emphasize that it is never the mother's fault. It's typically a process of randomization during cell replication that ends up leading to the unfortunate situation, and it is important that psychological help as well as physical and mental well-being of the mother is emphasized during the entire process, as well as during the recovery. Thank you very much for taking the time to watch this video. If you have any questions, please feel free to leave them in the comments, and also feel free to leave any comment on how I can improve the video. Thank you very much. Hope you have a great day. Bye.